So let's quickly look at how calcitonin can be used to treat hypercalcemia. And what is hypercalcemia? Hypercalcemia is simply what? When the levels of calcium in the body are more than what is needed. Okay, so you have an hypercalcemic state. So calcitonin is basically a hormone that is released from what? All right, and is used to what? Treat these elevated levels of calcium in the body. Okay, so how does it work? Okay, we have the full notes here. Okay, but at least let me just use this picture to, but let's go into the notes first before we go into the picture, right? So let's go into the note first. Calcitonin is used to treat hypercalcemia in the following ways. It can reduce, okay, it leads to rapid reduction of calcium. So calcitonin is used to rapidly reduce calcium levels of the body. How about the transient effect? Calcitonin's effect on calcium reduction is transient, so it must be given simultaneously with a biphosphonate. Okay, how about the dosage used? Calcitonin dosage for hypercalcemia is typically what? 4 units per kilogram subcutaneous injection every 12 hours. All right. Combined therapy. Calcitonin is often used in combination with what? Biphosphonate to manage hypercalcemia. Symptom relief. Calcitonin can help relieve symptoms of what? Hypercalcemia, such as what? Muscle weakness and abdominal pain and all the stuff. The main thing is basically this image. What are the effects of calcitonin on calcium in the body? All right. So calcitonin can lead to what? Calcium reabsorption in the kidney. You know that calcium is reabsorbed in the proximal convoluted tubule. So calcitonin will now stop reabsorption. So now more calcium will be removed through urine. Okay, that's first one. The second effect, it promotes deposition of calcium in the bones. Do you know what this means now? It will send calcium to prison. Hey, calcium, go into the bone, get locked up. Do you understand? It will also inhibit calcium reabsorption by the intestine. Oh, this is just absorption. Then ultimately it will lower calcium levels in the blood because calcium is being locked in prison in the bones. Calcium is being excreted in urine. Calcium is being what? Not being absorbed in the intestine. That means it's being what? Defecated. All right. So it will ultimately reduce calcium levels in the blood. This is how you can use calcitonin to treat what? Hypercalcemia. See you guys pretty soon.